Okay. Okay, so I'll be doing what's called a cranial nerve assessment. I'll be testing cranial nerves 1 through 12. This is on behalf of my physical assessment class, Professor Susan Bashinsky, Nursing 221. First thing I'm going to do is I'm going to provide patient privacy, hand hygiene, and explain the procedure to my patient. Hi.
Hello.
I'll be doing a cranial nerve assessment, cranial nerves 1 through 12 today, and the point of the nerve assessment is to basically test your overall functioning. Is that okay?
Yes.
Okay, great. So let's get started. So the first thing I'm going to do is I'm going to check for cranial nerve number 1, and that is the sense of smell. So I need for you to close your eyes, and I'm going to put something to your nose, and you just tell me what you smell, okay? Okay, can you tell me what you smell?
Strawberry.
Okay, cranial nerve number 1 is intact. This is exactly that, strawberry. Okay, you can open your eyes now. Okay, so I'm going to move on to cranial nerve number 2, and that is the optic nerve. So in this cranial nerve, we're going to be checking for peripheral vision and visual acuity. Okay, so I just need for you to stand up and face me. Okay, so I'm going to ask you to include one eye, and I'm going to include one, and tell me what fingers you see, how many.
3.
Okay, now your other eye.
3.
Okay, one more time.
4.
Okay, so that part of the cranial nerve assessment is intact. Okay, so here we have what we call the Snellen test. And this is to check for visual acuity. Okay, so I'm going to stand next to you. Okay, first, what is your name?
Darren Robert.
Okay, Darren, do you wear glasses?
Yes.
Okay, could you make sure that you're wearing them for this part of the assessment?
Mm-hmm.
Okay, great. Now, I just need for you to pick a line and read it from left to right.
LEFODPCT.
Okay, so cranial nerve number 2 is intact. There I was able to read the entire line from left to right, as well as his peripheral vision is intact. So cranial nerve number 2, in fact, is intact. Okay, great. So Darren, I need for you to sit back down. Now the next cranial set of nerves I'm going to check is cranial nerves 3, 4, and 6. So that's going to be our ocular motor, our trochlear, and our abducens. So first I'm going to check for the 6 cardinal gazes. Next I'm going to be checking for accommodation and constriction. Okay? So Darren, I'm going to need for you to keep your head perfectly still for me. And wherever you see this pin light, I just need you to follow with your eyes. Don't move your head. Don't move any part of your body, just your eyes, okay?
Mm-hmm.
Okay. Okay. So the next part of this test, I am going to close the blinds and test for constriction. And that means if we were in an office, I would be dimming the lights. Okay. Okay, so Darren, I just need for you to concentrate, focus forward. And before I close the blinds, I know that Darren's pupil size is a 3. So I'm going to see if it constricts down to a 2 or 1. Okay. So, Darren's pupil size did go from a 3 to a 1. Okay, so let me open the blinds or turn back on the lights. Okay. Okay. Now I'm going to check for accommodation by bringing the pen light towards his nose and asking him to keep his head perfectly still. So Darren, I'm going to ask you to face forward. Don't concentrate on anything but the pen light. No matter where this pen light goes, just keep your eye on it, okay?
Mm-hmm.
One more time. Okay. So cranial nerves 3, 4, and 6 are intact. His cardinal gazes are intact. Eyes are pearly. Pupils are equal, round, reactive to light, and accommodating. Okay. So next, we're going to assess for cranial nerve number 5. That is our trigeminal, and that is responsible for mastication. Okay, so Darren, I'm going to ask you to bite down, and I'm going to check for your masseter muscle as well as your temporal muscle. Reason being because those muscles are responsible for our chewing processes. Okay. Okay. Can you open and close your mouth? Okay. Okay. And one more thing. Can you try to push your head against resistance? Okay, so cranial nerve number 5 is intact. Masseter muscles and temporal muscles are intact. He's able to push his head against resistance. Okay, so while we're here, we're going to check for cranial nerve number 7. That is our facial nerve. Basically, we're checking for facial expressions. Okay, so Darren, I'm going to ask you to keep your head still, and anything I ask you to do, you just try to do to the best of your ability, okay?
Mm-hmm.
So, can you lift your eyebrows? Can you smile? Can you puff out your cheeks? Can you frown? Okay, so cranial nerve number 7 is intact. He can lift his eyebrows, puff his cheeks, smile, and frown. And while we're right here, we also can test for cranial nerve number 12, the hypoglossal nerve, which controls tongue function. Okay, so Darren, keeping your head perfectly still again, I need for you to stick out your tongue and try to move it left to right or side to side. Okay, so cranial nerve number 12 is intact. Okay, so next we're gonna move on to cranial nerve number 8, and that is our vestibular cochlear, which is responsible for hearing. So what I'm gonna do is I'm gonna include one of his ears, and on the opposite side, I'm gonna whisper a couple of words and allow him to repeat it back to me. Okay, so Darren, I'm gonna include your ear, and I'm gonna whisper 2 words, and you just repeat them back to me, okay?
Mm-hmm. Apple, banana.
Good.
Ice cream, cake.
Okay, cranial nerve number 8 is intact. Those were the words, in fact, I did whisper. Okay, so while we're right here as well, we're gonna check for the the glossopharyngeal nerve. That is cranial nerve number 9. So I'm gonna ask my patient to say ah, see if his uvula moves upward, and try to elicit a gag reflex. Okay, so first let me look into your mouth. Can you say ah? Okay, so uvula did move up when he said ah. Now let's see if we can elicit a gag reflex. So I'm just gonna poke back there a little bit. Okay, so cranial nerve number 9 is intact. We were able to say ah and elicit a gag reflex. And next, we're gonna go on to cranial nerve number 10. That is our vagus nerve. And here we're gonna assess for hoarseness of our vocal cords as well as our swallowing. So Darren, can you tell me what your name is, your full name, first and last, and what today's date is?
Darren Roberts.
Date?
April 9th, 2026.
Okay. Now while we're right here, can you swallow for me? Okay. So cranial nerve number 10 is intact. His speech was clear, logical, and he was able to swallow. Great. So our last cranial nerve we'll be testing today is cranial nerve number 11. That is our accessory nerve, also known as our spinous process. So what I'm going to have you do, Darren, is I'm gonna have you try to push against my hand, move your head up and down, right, left, and try to push your shoulders against resistance. Hunch your shoulders against resistance, to be specific. Okay? I'll push your head against my hand. Okay? Now the other side. Okay? Now can you move your head up, down, side to side? Okay? Great, great. Now, I'm gonna put my hands here and I want you to try to shrug your shoulders against resistance. Okay, cranial nerve number 11 is intact. So that completes my assessment for today of the cranial nerves. Cranial nerves 1 through 12 were intact. Darren, do you have any questions for me today?
No.
You sure?
Positive.
Okay, great. So let me open these doors for you. Wash my hands. I will document my findings. Okay, so if you don't have any questions for me today, that completes our assessment. Thank you so much, and you have a wonderful day, okay?
Thank you.